Hi everybody, welcome back to the channel. Today's video is going to be about all the changes that are happening to California's Medi-Cal program between January 1 of 2026 and 2028.
These updates may affect eligibility, coverage, renewal requirements, and potential costs for certain Medi-Cal members. Our goal is to clearly explain these changes so you can better understand how they may apply to you or the individuals you serve.
Hi everybody, my name is James. I'm the director of the Patient Resources Department at Kheir Clinic here in Los Angeles, and this is my colleague, Katie Flores-Priego. Hello. All right, we're going to go right into it. The first change that's happening starts on January 1 of 2026. Asset limits. Beginning January 1 of 2026, Medi-Cal will reinstate asset limits for certain populations. When individuals apply for or renew Medi-Cal, the county will review what they own, referred to as an asset check.
This policy applies to individuals who are age 65 or older, living with a disability, residing in a nursing facility, or part of a household whose income exceeds federal tax-based Medi-Cal rules.
That's right. The asset limit will be $130,000 for one individual, with an additional $65,000 allowed per household member, up to a maximum of 10 people.
Assets that are counted include bank accounts, cash, and additional homes and vehicles. Assets that are not counted include the primary residence, one vehicle, household items, and certain retirement accounts.
For those affected, asset checks will occur annually at renewal. Yeah, annually at renewal.
Another significant change is the enrollment freeze for full scope Medi-Cal for certain adults based on immigration status.
That's right. Starting January 1 of 2026, adults who are undocumented or lawfully present immigrants age 21 or older who are not pregnant will no longer be able to newly enroll in full scope Medi-Cal.
It is important to note that individuals already enrolled in Medi-Cal may remain covered, regardless of immigration status, as long as they complete the renewals and continue to meet program requirements.
If coverage is discontinued, individuals have 90 days to resolve the issue. After that period, eligibility will be limited to restricted Medi-Cal, which covers emergency services, pregnancy-related care, and nursing facility services.
Children under 19 and pregnant individuals remain eligible for full scope Medi-Cal, provided all other eligibility criteria are met.
That's right. The next big change will be changes to dental coverage, and this starts in July 1 of 2026. Starting July 1 of 2026, some Medi-Cal members will experience a reduction in dental benefits.
This change affects members who are age 19 or older, not pregnant or postpartum, and who have certain lawfully present immigration statuses, including individuals subject to federal 5-year waiting period.
Under reduced scope coverage, members will continue to receive urgent dental services, such as treatment for severe pain, infections, and tooth extractions.
Pregnant individuals will continue to receive full dental coverage throughout pregnancy and for 1 year postpartum. So beginning July 1st, 2027, some Medi-Cal members will be required to pay monthly premium to maintain full scope coverage.
This applies to individuals aged 19 to 59 who are not pregnant and who qualify for Medi-Cal through certain state-funded or humanitarian immigration categories.
Failure to pay the required premium will result in a transition to restricted Medi-Cal coverage only.
Okay, and the next big change is going to be work or volunteer requirements. Now, this change does not start until January of 2027, but starting January 1 of 2027, some adults will be required to meet work, volunteer, or educational requirements in order to obtain or retain Medi-Cal.
Many groups are exempt, including children, older adults, pregnant and postpartum individuals, parents of young children, people with disabilities, and other specified by the state.
Yeah, for those subject to the requirement, individuals must complete at least 80 hours per month through employment, volunteer work, education, training programs, or a combination of these activities.
For new renewal frequencies that are effective starting January 1st of 2027, some Medi-Cal members will be required to renew their eligibility every 6 months, rather than annually.
Yeah, this applies to adults aged 19 to 64 who do not have children under age 19. Members will be notified by mail if this requirement applies to them, and this new renewal frequency starts January 1 of 2027. Okay, next up we have excuse me, coverage of past medical bills, and this is effective January 1 of 2027. Another change affects how far back Medi-Cal can pay for medical bills incurred prior to your enrollment.
Depending on household circumstances, coverage of past expenses may be limited to 1 or 2 months rather than the current 3-month period. Co-payments that will be effective October 1st of 2028. Starting October 1st, 2028, some Medi-Cal members may be required to pay co-payments for certain services.
That's right. Co-payments will apply only to non-pregnant adults ages 19 to 64 who earn more than $15,560 annually. Total co-payments will be capped at 5% of annual household income.
Preventative care, emergency services, mental health care, prenatal services, and pediatric care will remain exempt from co-payments.
Okay, I think that was the last change. I think we covered 7 of them. And I know, Katie, you've been working here at Kheir for a while now, and pretty much every day we spend a lot of our time doing new Medi-Cal enrollments, but also renewals. And I wanted to ask you, what is the most common issue you see our community members facing when it comes to renewal time?
Usually the most common comment that they make is that they don't receive their renewal in the mail.
Okay. So I know there's several ways you can renew your Medi-Cal, and currently it's once a year. I know in 2027 it'll be a biannual renewal, and we still have some time. But for the 1 year that we have until we have to start renewing biannually, what are some ways? Because if the biggest complaint is, hey, I never received my packet and I don't know how to renew. I mean, and basically, what are the other options to renew if you don't renew it by the paper packet that you receive in the mail?
Another option that's been offered is Benefits-Cal. With Benefits-Cal, it's an online portal where you can access your Medi-Cal or CalFresh or any program that's offered.
Okay. And so, but if you open up a Benefits-Cal account and you sign up for an account, there's a like a case number or something that you need to successfully submit, don't you?
Yes. So you'll create your Benefits-Cal with an email account. Once you're logged in, you can click a link where it says to link your case. And by doing so, you'll receive all your mail online.
Okay. And in order to link your case, you need something called a case number, right?
Correct. Yes.
Now, we deal with this every day, so we know a lot of folks don't know what their case number is. So where can you find or obtain your case number?
If you receive CalFresh, at the bottom of your card, you'll have your case number. Another way is if you have received mail in the past, top right corner, there should be a case number that includes letters and numbers.
That's right. For people who live, in the neighborhood that we predominantly serve, which is Koreatown and Greater Los Angeles County, a lot of the mail comes from DPSS Northridge, right? I see that a lot. And if you receive your renewal packet, great. If you don't, you'll receive other forms of documents from DPSS, request for information, a letter saying that you were approved or disapproved for a certain program that you might have applied for. But every time you receive something, in the upper right-hand corner, you do get a case number. I believe it starts with a letter, and then it has additional letters, and then it's like 6-7 digits or something like that.
Yeah.
But that code, if you will, is key to you linking your Benefits-Cal account that you just made to the information that they have at DPSS. Without it, it's difficult to renew. So, I mean, going through all these different changes, I think the biggest key takeaway from everything we've explained today is, number one, the enrollment freeze is happening soon, right? And that's for all what we call unsatisfactory immigration status individuals, basically, undocumented. Starting January 1 of next year, new enrollees will no longer have access to full scope Medi-Cal, which is all the preventative services, referrals to specialists, most of the things that we would need to stay healthy will go away for new enrollees. However, prior to January 1 of 2026, if you're enrolled, you still have to be proactive about renewing. So renew. But in order to receive the materials to renew, going back to what you were saying, your information needs to be current on in DPS's record. So what is the best way to make sure that your contact information stays current with DPSS?
Benefits, Cal. Patients have 10 days to report any changes. This can be done through Benefits, Cal, whether it's your address, phone number, add a new member. Knowing your case number is very important to make these changes.
Okay. Was there any other common, not mistake, but common occurrence that you see in our patient resource department that you feel like, hey, I think community members would benefit from this kind of information? If not, that's fine.
No, I don't think so.
Yeah, I don't think so. I think the biggest thing is
Not knowing your renewal date.
right.
Yeah.
Right. Gosh, what is the best way to find out about your renewal date? It's really on the letter that you get from DPSS, right?
You can also call or visit a local office just to have this information. Whether or not you know your renewal date, just knowing your case number is very important. We can find these things out online.
Yeah. Okay. Great. Thank you. So we're gonna go into our closing now, which we have all written down here. These upcoming changes represent significant updates to the Medi-Cal program. Staying informed, opening all Medi-Cal correspondence, which means letters from Medi-Cal, and responding promptly to renewal or eligibility requests will be essential to maintaining coverage.
If you need assistance understanding how these changes apply to you, or if you would like help with Medi-Cal applications, renewals, or questions about your coverage, support is available.
That's right. You can, as Katie mentioned earlier, you can visit your local DPSS office. They're all throughout the county of Los Angeles. But we understand that there's cultural barriers, language barriers, transportation barriers. If you are local here to where our clinic is, which is in Koreatown, Los Angeles, you can either contact us by text message at 213-632-5521, or you can visit us in person at our Kheir headquarters, which is in Koreatown at 3727 West 6th Street, suite number 230, and the zip code is 90020. Katie and I will be here. All of our other PRD or Patient Resources Department staff can help in person.
Our team is available to provide guidance, answer questions, and help you navigate these changes.
Okay. And this is the time where I tell you, thank you for watching. We appreciate your time and attention. Please stay connected and reach out if you need support. If you found this video helpful, please subscribe to our channel. We're going to be producing a lot of hopefully useful videos for you guys to gain some information on. Try to share the video with people that you know in your circle of friends or your loved ones or family that you feel would benefit from this this information, because there's a lot of changes happening and we don't have much time left until the changes happen. So thank you for watching. We're going to see you guys in the next video. Bye-bye.